Hi neighbors. I promised you in the last video that in this video I would talk about emergency shelter. Cringing a little bit, but I'm going to keep my promise. I hope you won't be surprised to learn that I will be focusing mostly on families with children. I want to say a couple of things about the broader emergency shelter conversation though first, which is that emergency shelter is an important part of our continuum of services in any community, and that is certainly true here in Whatcom County. We will likely always need some capacity of emergency shelter. It is my hope and suggestion that as a community we start to have the conversation about what types of emergency shelter we need and how much, and that we then make a commitment as citizens, as the private nonprofit sector, as philanthropy, as governments, to funding enough housing services such that we don't overwhelm the capacity of the emergency shelter system that we have built. Before the pandemic, we had roughly 42% of households here in Whatcom County were struggling to meet basic needs. I don't know what that number is now, but I share that with you because I want us all to remember that this problem around housing and homelessness, it's not just about those we see on the street or the families with kids that we don't see. It's about a broader system where households here in Whatcom County are really struggling to make it work. And we've got a lot of thinking we need to do about what our vision is for our community. Do we have one? I'd love to hear your vision for this community. Maybe if we could rally around a shared vision, we could make some progress. Emergency shelter for families with kids. You know, families with children they're really the invisible part of those experiencing homelessness. We don't talk about them often. They have not been much a part of the conversation of late here in our community. You may not know this, but for many years, a full 25%, so 1 in every 4 individuals experiencing homelessness was a child. The way that we address emergency shelter response for families with children here in Whatcom County is through motel stays. That is almost exclusively the way that we respond to unsheltered children and their caregivers. Right now, we have roughly 65 families with kids in emergency motel stays. We have seen those motel stays getting longer and longer over the past year. Sometimes up to 6 months in a motel. I'm a mother of 3, and I can tell you, I don't know how I would survive taking care of my 3 kids and all of their needs from a motel room with nothing more to cook with than a microwave and a bathroom sink. It is not a trauma-informed best practice way to respond to children and their families who are experiencing homelessness. And I would really love, as a community, if we started talking not about the cheapest or the quickest way to respond, but the most effective way to respond, the best possible way to respond, so that we as a community could be proud of the way we respond to crisis and those who need support. I told you in the last video about the different types of housing programs that we have within our coordinated entry system. So thinking back to the diversion programs, folks who need like deposit assistance, rapid rehousing, which is that medium level of support, and then permanent supportive housing, which is really intensive and really expensive. Just by way of comparison, it costs us as a system, as a community, $38 a day to have someone in a rapid rehousing program. It costs us $238 a day to have someone in emergency shelter. I share this with you because not because I am against shelter. Shelter is critical and important, and we don't want anyone suffering on our streets because of a lack of options. And at the same time, we must make investments in our housing systems such that we have less people in crisis to begin with. That is the way forward. It is the way out of this place that we're in, where the energy we're spending right now is investing in crisis response. If we only invest in crisis response, we will continue to keep people in a state of crisis, and we won't move them through into stability, which is what I know we want. So when I'm advocating for housing, it is because I want people housed, not because I want people to stay in an unsafe situation. All right. It is costing us, and this is going to be cringeworthy, a little bit more than $100,000 every month to keep those families in motels. And we will run out of that funding. This is state, city, county, and private philanthropy dollars that are being poured into this motel response this year. We will run out of that money in about 3 weeks. We're seeing about 5 new families through the Opportunity Council who are unsheltered with children every single week. And this too is a crisis. It is very expensive to keep folks in motels. And if we don't invest in the program openings to help move them through, that need is going to continue to balloon. We know that when we invest in kids, we see good outcomes. We see the dollars that we invest come back to us 5-10-fold over the course of their lifetime in other system responses, health, education, criminal justice, etc. For example, many of you may be familiar with the Adverse Childhood Experience study from the 80s. This is like decades old science. And what we know is that children with an adverse childhood experience score of 8, which means they experienced 8 adversities in childhood, 33% of them will become homeless as adults. When we focus as a community in reducing trauma, we will also reduce things like homelessness and all sorts of other things that we would like to reduce as a community. There's a lot more to this conversation. And I want us to set our sights on bold, clear, and inspiring opportunities and outcomes for everyone here in Whatcom County. In the next video, I want to talk about some of the options and opportunities that we have in front of us to invest in the housing system so that we can get towards what we want, which is less people in crisis. Okay. I'll talk to you soon. Be well.